My name is Jeannie, and I am the mother of a type 1 diabetic. I am not a medical professional, and I'm not trying to give medical advice. I am just one type 1 parent speaking out to newly diagnosed type 1 parents in order to just share some tips and advice and hopefully help save you a little time and aggravation. So today I actually want to talk about something very, very simple but highly important, and that is the Glucagon pen. So I know it probably sounds a little funny, but I actually want to talk about doing a glucagon drill. Everyone does, tornado drills or fire drills or hurricane drills. Well, if my daughter has a hypo, I want to make sure that the person who is caring for her is highly versed with what this tool does and, and is able to perform the task without freaking out and feel completely comfortable with, not that it's a comfortable situation, but as comfortable as possible with treating a hypo. So as you well know, there is instructions that come inside of this, and if you get this from your endocrinologist and you decide to wait until the day that you need it, this is what the instructions look like. Really long, really small print, and a lot of it. So in an emergency situation where your child loses consciousness, in no way, shape, or form are you going to appreciate having this to look at. So my suggestion to you is to go ahead and pull this paper out, highlight the important spots, but also another thing that I do is I write the dosing on the outside of the container, so that way when someone, if anyone has to use it, they have the dose right there. Also, I write important phone numbers on the inside on a little piece of paper. I stick inside with important phone numbers as well, because in an emergency situation you want to make sure that they don't have to scramble or their phone's not dead or you name it, just covering all bases here. So when my daughter was first diagnosed, I actually got a couple of different glucagon pens in the beginning, and then I have received one every single month. And I know you don't need one every single month. As a matter of fact, I've never used one, but I order one every single month with my daughter's prescriptions. So basically, I have a medicine cabinet in the house where I store them. On the inside of the cabinet, I have important phone numbers and everything written down there. I keep one in her bag that stays with her at all times. I have one at church in the nursery. I have one at her school. I have one pretty much every place that my daughter will go. That's where I have one. So if you have a sister that you go and visit on a regular basis, or she stays at her grandparents or wherever, that's, you want to have as many glucagon pens around as possible. All right, I'm back. Mommy moments. So, anyways, let me tell you a little bit. Okay, so I write the dosing on the outside of the pen. I put the important phone numbers on the inside of the container. I have them pretty much stored everywhere, and you want to keep in mind that they do expire. So I think they last for about a year, so you want to make sure to change them out and rotate them. So what I want to tell you is that I actually took one of the first glucagon pens that I had, and if you are going to have someone caring for your child, you want to make sure, absolutely positively sure, that if an emergency situation came about, that they would know how to use this. So I actually took one of these and I used it as a sample, as a just a demo, and anybody who is taking care of my child has gone through a glucagon drill with me. So, I really feel like that's important, because in an emergency situation, if you have a child that's unconscious, a lot of people can panic. So when you're panicking and you're scared, it's not gonna be as easy for you to perform something like this. And I just feel like a lot a lot of people are thankful, you know, and I'm thankful because I feel now like, you know, they know what they're doing. They know how to use this if something happens, and they don't have to try to figure this out. You know, time is, you know, highly important, especially if your child's unconscious. So you want to make sure that they know exactly who to call, when to call, exactly what, you know, how to inject this, how much to inject. And you are trusting someone else to put a needle inside of your child and to save their life, and they will be the first responder before the first responders can get there. So, you know, it's just really, really important. If you haven't done it, go ahead and do it. I can't tell you how uneasy I felt when my daughter was first diagnosed with, and I'm still uneasy. I mean, it doesn't get better in that sense, but, you know, you can feel a lot more comfortable if you've gone over these things. So I'll tell you a little story. And I don't know why, but I'm sure you guys have probably freaked yourself out too, but it was just a few months after my daughter's diagnosis, and I was going to church. I was sitting in a sermon, and I never, you know, daydream when my pastor is preaching, but I happened to do it that day, and I had just gone over, you know, with them, you know, how adrenaline affects, you know, her blood sugar, and just the different things that affect her blood sugar, and how to handle things. And I actually just got a little freaked out. I had like this nightmare, daymare or whatever, and I was sitting there daydreaming about her having a low, you know, what if she has a low? And then I imagined these youth running around and trying to scare the camole out of my daughter with their Halloween mask. Now, I know this is ridiculous and it did not happen, but, you know, I freaked myself out enough that I had to get up and go look, you know, and that's what I'm talking about. I'm talking about, you know, the fact that you never feel comfortable when you leave your child, even without having diabetes. But this puts an extra, you know, fear, because you just never know when they're going to have a low, and you know, and if the person that you're leaving them with is going to be, you know, handling the situation correctly. So it's really important, you know, in an emergency situation. I mean, I could go on and on about, you know, training them, you know, with insulin and, you know, checking blood, but that's a necessity. So a lot of people don't go over the glucagon pen, and they don't even look at it until the day that they need it, and I just feel like that's a mistake. So let me make sure I got everything. So, oh, I want to talk about insulin. So I know a lot of people don't know this, but if you give insulin first thing in the morning, like say Lantus or, you know, whatever, Levemir, or you just give a, you know, a bolus for something, and your child gets into a hot bath or a hot shower, more than likely, and I can't tell you how many times I've heard this, people talking about it, that their child has a low after a shower, or a crazy low out of the blue, you know, after having a bath or a shower. And that's because, you know, when you just inject the insulin, that hot water, you know, gets the circulation going, and it causes that insulin to metabolize faster. So just be mindful of that. It's just a little tip. I know it's kind of like out of the blue there, but, you know, that's one thing that, you know, I've seen people, you know, talk about having the worst low they've ever had, and it's followed by, you know, just having an injection and going and taking a hot shower or a hot bath. So that's that. Also, I've also heard people talk about using glucagon for a low. So I really think that's a bad idea. I'm not a medical professional, so ask your doctor about it, but you know, honestly, especially if you're doing a low-carb, high-protein diet or high-fat diet, you don't want to deplete your body of all of its glucagon store for no reason. If your person is awake and is conscious and can drink or eat, then that's what they need to do. You know, I wouldn't subject my child to this for no reason. Let's see. No. Oh, also treating lows. So I notice a lot of people over treat lows. So for instance, if your child is on their way low, and I guess 70 to 120 is considered normal range. So if your child is on their way down and you see that they're going low, the normal doses is 15 carbs. So I actually have been treating my child with glucose tabs, and you just tear off just a small little piece. You don't want to give your child a lot of high fructose corn syrup, which I'm sure a lot of people say they use Skittles and this and that. And of course, if you use Skittles, your child is definitely going to come up. But you've just given them a ton of high fructose corn syrup, which is going to cause this yo-yo effect of up and down, because, your child's low, you give them all this sugar, they skyrocket up, then you got to give them insulin again. Insulin causes lows, comes back down, and then you're on this whole roller coaster effect. And I just don't want you to have to go through that. So, when you're treating a low, it normally takes, they say 15 minutes and then recheck. Well, I have timed it. It takes exactly 20 minutes for my daughter's blood sugar to rise when I give her a glucose tab. So I might give her a quarter of a glucose tab or a half a glucose tab, and then check her in 15 or 20 minutes. And via stick. Don't do it with the Dexcom because it's always behind. And then see where she's going. And if they're going up, then it's worked. But you have to wait. If you have to wait that 15 to 20 minutes, and you can kind of time it and see, okay, I know I'll check her or him, and in that time, if you can figure out exactly how much time it takes for him to come up. So, and you can also do it in the mornings before breakfast. When you give them the insulin. Oh, that'll be another post. Sorry. So that's basically it. Make sure to treat the lows. Make sure to wait enough time for the sugar to work. Juice contains a ton of fructose, so you're gonna see that juice and high fructose corn syrup and the candies, that's all gonna work a whole lot faster. But it's also gonna bring your child up really, really high. And then you'll figure it out. It's kind of a perfect balance, but the glucose tabs work well. They just probably won't raise your child as high as the fructose or the high fructose corn syrup. So that's my post. I just wanted to get that out there. So if you're newly diagnosed and you got one of these, which I'm sure you did, then pull it out, read the instructions, write the information down, go over it with the people who are caring for your child, and have a little peace of mind when you have to leave them. Bye.